Outbreaks in New South Wales and Victoria have now thrown up hundreds of cases, and with them exposure sites. We heard from Gladys Berejiklian today that 60 of today's cases were infectious in the community. And every time this happens, these sites are cleaned out and disinfected from top to bottom. Cleaners are doing vital, life-saving work right now. And yet, 17 months into the pandemic, we're still seeing unequal treatment for those doing this work. Last week, a group of 200 cleaners at Sydney's Westmead Hospital refused to enter the hospital's COVID ward after they say they were denied access to protective equipment.
I think this is an oversight of the management who will look at two different sets of workers in health. That you have professional health clinicians and you have 50% of the people working in health who aren't. And this is a classic example of those who are keeping COVID out of the hospital not being looked after the way they should be looked after.
Last week, a contract cleaner at an aged care home in Sydney's West tested positive to COVID, at least the second in this outbreak, and all the while cleaners who are working outside of the healthcare setting aren't being prioritised for vaccinations, including those working in aged care. To tell us more, we're joined from Sydney by the founder of Alinga Services, a commercial cleaning business, Badi Mahabat. Good day, Badi. How are you? Thank you for coming in.
Pleasure, thank you.
Now, this is a fascinating business that you run, and your own story is fascinating. We don't have time to hear your whole story, but you've got 600 workers, and you are doing this amazing work. This company is doing this amazing work, sending them out to the trains, the buses, telling me about all the things that they are cleaning. Sometimes when we're in bed, and which you know are really the front line in stopping this COVID virus.
It runs the gamut, as you mentioned before. You know, trains, buses. We're involved in some of the border security, the quarantine buses, from taking passengers from flights to the hotels where they're going to be quarantining at. Yeah, we've done ferries, we've done wharves, public spaces, infected areas or hotspots of buildings, where we've had residents test positive. We get called to a variety of different areas, and, it's gotten busy the last couple of weeks.
I think that's an understatement. Over the past year, more than 2.6 million train carriages have been cleaned by Alinga Services under these COVID-safe protocols. So how do you get a workforce of culturally and linguistically diverse people coming from all over Sydney and get the equipment and get them to understand how to do this work without infecting themselves?
I think from the outset, our workforce have been quite very aware of the dangers that they themselves face. And if you're not safe, then you can't keep others safe. And I think that's kind of the message that we reinforce with our staff. Also, we have very thorough systems in place, just to ensure that these guys are continually looking after themselves and their other staff as well as they go through their duties in trying to, disinfect and sanitize the areas that we're called to. Culturally, at the end of the day, COVID overrides everything. It's one culture. Everyone just seems to fall behind that generally. Language-wise as well, we do have different systems and protocols. It is different. The variety of different cultures that we have in our workforce, you can imagine, are quite diverse. So it does make for interesting company communications.
Okay, but just get into the detail for me. You can't just say to somebody, here's an N95 mask, and off you go with somebody who might be from a different cultural background and not speak the same language as you. That's not going to work. So what have you done?
No, you can't. So we have, like I said before, we have very, very complex, we think, thorough systems. We're always checking them. They do get audited. For example, the training bud is quite considerable. Before you step onto a site, we teach you how to put an N95 on. Like you said as well, it's not as simple as just putting a mask on and there you go. To put an N95 mask on, you have to do a seal test. You hold it through little puffs of air to make sure that it's sealed up properly. Even while you're going through your work, we have a check verification system where, a staff member is assigned another staff member to look after. And what that means is, through the entire shift, you're continually checking to ensure that their PPE hasn't moved, hasn't dislodged, or, they're not at risk. The mask hasn't moved, there's a tear in the gown. Or generally how they're working isn't putting themselves at risk. Simple steps go along the way, but then it's reminding staff doing, pre-worksite chats, sitting down, running through the processes again, the toolbox talks, identifying what the risk could be, and just reinforcing the need for everyone to be vigilant and aware.
Yeah, yeah, and you were telling us, buddying up people from different backgrounds with the same backgrounds, buddying up people who speak the same language, so that they really can speak to each other about, now come on, stay on it, stay on it. Now, the one thing you can't give them is vaccination, can you?
Not all of them. So we do have a bit of disparity or discrimination that occurs between the workforce. So some of the workers qualified under the 1A rollout, and these were the workers working as part of the quarantine program at the airport. These guys were vaccinated immediately as soon as they were available, and all of the staff working on there, even when they come on, are immediately vaccinated, and they're not allowed to work actually without the vaccines. But like you're saying, then we have other workers who might be sanitizing trains or buses generally in other areas, or attending buildings which haven't been sanitized, who don't, because of age, as simple as that, 30, 35, don't qualify for the vaccine process as well. There is no hesitancy, there's no vaccine hesitancy amongst any of our staff. If anything, we receive a consistent flow of requests from staff for the vaccine. When do we qualify? Do we qualify? Is the work that we do entitle us to the vaccine? Is a common question that we get.
Neela, these people are willing to do this work, right? And they're asking those questions. Oh my gosh.
Look, first I just want to say, let's put Bardi in charge of the Federal Health Department, because he's got this all worked out. I think it is so important, and I think this is such a fantastic story to have, because there is so much data from Victoria last year to show what happens when you don't take care of cleaners. Osman Faruqi looked into this for the Saturday paper, and what he found was that there were 3 industries that had the largest number of WorkSafe notifications for employees testing positive, and they were aged care, healthcare, and cleaning. And we know that particularly for cleaners, they often live in larger households. And so if one person gets infected, then it goes through the whole household. They often do live with other cleaners in the way that, healthcare workers sometimes live with other healthcare workers. And so it spreads to different work sites, it spreads to different workplaces. And because they work in such a diversity of environments, as Bardi has told us, if someone does get sick, then it becomes very easy for them to transmit it onto other people. So towards the end of Melbourne's long lockdown last year, we saw that it was transmission from a cleaner to a butcher shop that prolonged that epidemic, and that then got spread out to the Victorian regions. So I think that, I'm so pleased to hear that cleaners in this agency are being given proper airborne precaution, are being given instructions to use it. And what I would say is that, in terms of the culturally and linguistically diverse element, a lot of people actually have quite a lot of experience in living with and managing infectious diseases, people who have migrated to Australia from other countries. So I have not experienced any hesitancy in trying to be as careful as possible. It is actually just about giving people the equipment that they need. And we know that in Victoria last year, we had cleaners being sent in without any of this protective equipment, being told to bring their own cloth masks to do these jobs, and the problems that created. So this is absolutely fantastic. And cleaning agencies around the country should absolutely adopt these kinds of interventions.